16th century Japan. It was a time of social upheaval, political intrigue, and of course, badass samurai. The emperor, largely a marginalized and ceremonial figure, delegated power to the shogun. But as the century progressed, the shogunate began to lose its control over the local lords. Japan was in the throes of civil war. Now, everybody knows of the noble samurai of feudal Japan, but did you know that there's another secret group of highly trained assassins called the aminoglycosides? Aminoglycosides are bactericidal, even though they work on the bacterial ribosome, just like the other antibiotics in this unit. However, while before we had been using a ribosome typewriter to convey a bacteriostatic mechanism of action, this time we will represent the ribosome a little differently. See these three translators sitting in this booth wearing their customary tRNA-themed hats? Well, they are translating out a long sheet of kanji, just like a long peptide sequence being produced by the ribosome. Aminoglycosides are irreversible inhibitors of protein synthesis. They do this by binding the 30S ribosomal subunit, inhibiting formation of the initiation complex, also leading to misreading of mRNA, killing the cell. And just like inhibition of the initiation complex, our scene involves the abrupt halting of a feudal initiation ceremony. One of the translators slumps over, kanji smeared and illegible like misread mRNA. A sigh from some unknown assassin is revealed lodged in his back. Remember psi for aminoglycoside. Well, the assassin is spotted, suspended from the minute hand of the clock tower, here to represent binding to the 30S ribosomal subunit specifically. This assassin is not alone, however. The most common clinical application of aminoglycosides is in the treatment of serious infections caused by aerobic gram-negative bacilli. To see how aminoglycosides sneak their way into gram-negative bacteria, take a look at the imperial palace wall. The red bacilli-shaped stones throughout the wall should remind you of the gram-negative cell wall. Aminoglycosides are actively transported across the cell membrane to get inside bacteria. However, first they need to get past the cell wall. Therefore, they are coupled with cell wall active drugs, such as beta-lactams or vancomycin, to enhance their ability to penetrate cells. Think of it this way. See our aminoglycoside assassins at the gram-negative wall? To help them through, they are throwing beta-lactam bombs. Beta-lactams in previous sketches were shown with their eponymous beta-lactam ring, symbolized by a ringed planet, which looks exactly like these bombs. These cell wall active agents are allowing our aminoglycoside assassins to sneak into the palace. Once past the wall, aminoglycosides are actively transported into the cell via an oxygen-dependent process, highlighted here by one of our warriors using a bellows to feed the flames with oxygen. This is our recurring sketchy symbol for aerobic activity. So to sum it up, aminoglycosides are paired with a cell wall active agent to kill aerobic gram-negative bacteria, especially when the isolate may be drug resistant or there is suspicion of sepsis. Aminoglycosides have poor oral absorption, so we have an IV mode of delivery highlighted by our 30S suspended ninja's rope, made of IV. Alright, let's meet the warriors putting a halt to this initiation ceremony. First, Neomycin, the ninjutsu specialist. This ninja is highly trained in stealth, and he's sneaking his way in through an underground tunnel. This looks suspiciously like a colon, and that's because neomycin, when taken orally, stays in the GI tract until it's excreted in the feces. Therefore, it's useful in bowel prep before colorectal surgery, highlighted here by his favorite weapon, the scalpel shuriken. Paromomycin is a related drug that also stays active in the GI tract. We've seen it before in our sketchy microparasite sketches, and again it's represented by a pair of mice scampering through the tract. It acts as a luminal agent, active against intestinal parasite infections, such as Entamoeba histolytica. Next up, streptomycin, the psi-wielding wilderness specialist. If you're ever wandering a forest alone, always look up, because this guy is waiting for you. Streptomycin is effective in treating tularemia, caused by Francisella, and spread by contact with tick-ridden animals, as highlighted by his cute yet sinister rabbit hoodie. Streptomycin is also effective in treating the plague, caused by Yersinia pestis, which can be transmitted by the fleas on his small woodland creature minions. Cute but deadly. Next, say hello to gentamicin, the judo specialist, giving new meaning to the judo mantra, the gentle way. Gentamicin is used mainly in severe infections caused by gram-negative bacteria that are likely to be resistant to other drugs, including Enterobacter, Serratia, and Klebsiella, bugs that can lead to some serious hospital infections. He's making his way toward the Shogun, his arch-enemy. This rival leader will be covered in red gram-negative armor from head to toe, embodying all that is aerobic, gram-negative, and evil. This includes septicemia, nosocomial respiratory tract infections, complicated UTI, intra-abdominal infections, and even osteomyelitis. However, gentamicin is really here for the Shogun's daughter, the one with the most enigmatic smile in the entire province, resembling Mona Lisa, our recurring symbol for Pseudomonas, an important cause of nosocomial infection, and another aerobic gram-negative pathogen covered by gentamicin. Next to him is tobramycin, called the Cobra by his clan. Tobramycin has a spectrum of activity similar to gentamicin, and they both have activity against Pseudomonas. Aminoglycosides, when coupled with cell wall active agents, also have activity against Enterococcus, an important cause of endocarditis and UTI. The treatment of Enterococcus endocarditis usually involves an aminoglycoside, like gentamicin, coupled with a penicillin or vancomycin. We usually represent Enterococcus as a drummer in a rock concert, and this scene we have a taiko drummer next to the Shogun who's rocking out on a pair of purple taiko drums, highlighting the gram-positive diplococcus shape of Enterococcus. Enterococci, however, are intrinsically resistant to low to moderate levels of aminoglycosides. This is partly due to the presence of an acetylation enzyme that modifies aminoglycosides. To represent this mechanism of resistance, the drummer is throwing inactivating ninja stars at the tobramycin warrior. These inactivating enzymes are used by numerous fastidious gram-negatives. Say hello to amikacin, highly trained in the katana, most expensive, most broad spectrum, and resistant to many of the enzymes that inactivate gentamicin and tobramycin. It also has activity against Pseudomonas, and here he's about to capture the Pseudomonas bride. Amikacin, like all aminoglycosides, causes ototoxicity and nephrotoxicity, the two most important adverse effects to remember on an exam. Aminoglycoside-induced ototoxicity may result in either vestibular or cochlear damage, meaning it can manifest as vertigo, disequilibrium, lightheadedness, nausea and vomiting, and even ataxia, as well as the usual tinnitus and hearing loss. This gong next to our Imperial Samurai not only looks like an eardrum to remind you of ototoxicity, it is getting struck by an aminoglycoside psi and causing a ringing dizziness and ataxia in our enemy samurai. In many cases, the ototoxicity is irreversible. Nephrotoxicity will be represented by the samurai's kidney-shaped flank armor, also getting damaged by an aminoglycoside psi. These adverse effects are more likely to be experienced in the setting of renal insufficiency and with concurrent administration of loop diuretics or other nephrotoxic agents. Remember that this nephrotoxicity is due to acute tubular necrosis, or ATN. Whenever we encounter ATN, we'll sketch in a rusty rain gutter draining down brown, muddy water. This emphasizes the tubular necrosis and the resulting brown muddy casts seen on urinalysis. Nephrotoxicity results in rising serum creatinine levels and can also manifest as an increase in serum aminoglycoside levels. So, to prevent the accumulation of the drug and resulting toxicity, serum concentrations of the drug are routinely checked. We usually represent monitoring of serum drug levels with peaks and troughs, and here it's represented by this undulating mountainous terrain. Another rare but serious adverse effect of aminoglycosides is neuromuscular blockade. Therefore, myasthenia gravis is an absolute contraindication to aminoglycoside use. Myasthenia gravis affects the neuromuscular junction postsynaptically at the motor end plate. We usually represent a motor end plate with an electrical outlet. And here, this postsynaptic outlet design is incorporated into a grave to highlight myasthenia gravis. A sigh is embedded in the grave to remind you of the contraindication to aminoglycoside use. Alright, one more thing to remember. Aminoglycosides can cause deafness in the newborn, so are contraindicated during pregnancy. We'll sketch in a pregnant woman here next to the gong, which highlights ototoxicity. And since a tarantula is a recurring symbol for teratogens, the gong is engraved with the symbol of the rival tarantula clan. Notice she too is covering her ears. Well, it's that time. Let's sum up this ancient Japanese painting into a few important points. Aminoglycosides work on the 30S ribosomal subunit and are bactericidal. They are effective against aerobic gram-negative bacteria. They work in combination with a cell wall active agent, such as a beta-lactam, before being transported into the cell by an oxygen-dependent process. Neomycin, master of ninjutsu, master in the preparation of colorectal surgery. Streptomycin, psi wielder, animal lover, use it for Francisella and the plague. Gentamicin, the judo master, effective in treating systemic infections caused by aerobic gram-negatives. Has his eyes on that Pseudomonas bride. Tobramycin, the cobra, is highlighting the mechanism of resistance that involves inactivating enzymes. Kanamycin, most broad spectrum, also active against Pseudomonas. Watch out for that ototoxicity, which can manifest as vestibular damage and is the reason they are contraindicated during pregnancy. Watch out for that nephrotoxicity, which can manifest as ATN. Ninjas.